everyone, and welcome to Political Capital, your source for all the best in BC politics and during this federal election that no one wanted. Here we are talking about that as well. I think we're halfway through that-ish. It's hard to tell. Time is a flat circle when it comes to politics, but we have the original Pod Squad here to talk about all of it this week, and make sure you subscribe to get the latest from us, and make sure that either you're watching on the YouTubes or in the audio stream on your podcast, plus on the new Check Plus app, where you can get Political Capital on demand anytime you want, and you can Chromecast it to your TV or watch it on your iPhone or your iPad or whatever. It's actually a pretty cool app. All of our past episodes are on there in one convenient location as well. So let's bring in the panel and get to it, because we have a ton of stuff to talk about this week. Jillian Oliver, Green Strategist Extraordinaire, and I use that word extraordinaire specifically. Hello, Jillian.
Hello, good morning, Rob.
Maclean Kay, editor of The Orca. Hello, Maclean.
Hey, Rob. I also think we're binge-worthy.
We are binge-worthy. You can go through. We have the cliffhanger at the end of season 1, with, who shot Rob. It turns out everyone shot me, but that's okay. Not a spoiler alert there. But, and Katy Merrifield, Vice President, Wellington Advocacy. Hello, Katy.
Hello.
All right, let's get to it, because I think we might have a lot to say about our first topic here. Protesters, anti-vaxxers, anti-authority, anti-government, wackos, weirdos, tinfoil hat brigade, whoever they are, showed up en masse around the province, in fact, in some cases around the country, the legislature, and healthcare and hospital locations this week to protest BC's vaccine passport, mandatory vaccine for non-essential services plan, which comes into effect later in September on the 13th. Let's go around and talk about that, because it didn't go over so well, I don't think, but what are the elements behind it? What do we think, how it was executed? What does it mean for the debate we're having right now? Starting with you, Katy.
Yeah, so to start off with, obviously, peaceful protests are a charter right, but that right is certainly not absolute. I think what we saw this week was disgusting. Blocking ambulances, chanting "lock her up." It's wrong and it's dangerous. Politically, I want to talk politically here, though. I do think it's very easy to dismiss these folks as a lunatic fringe, and having like Laura Thompson, formerly of the PPC party, leading the chants makes that a lot easier. And for a lot of people, that label is absolutely true. I want to make that very clear. They are practicing willful blindness. No amount of messaging, cajoling, rhyme or reason is going to work with these folks. But I think ignoring the groundswell of anger and frustration and anti-state sentiment would be at the government's peril. I just saw earlier this morning, there's 112,000 members now in the BC Business Against Vax Passports Facebook group. Like that's fairly significant. So my caution is just branding these people deplorables leads to rage. It leads to more rage, and more rage turns to political action. And look no further than Trump in 2016 to see where that takes us.
Mm-hmm. It's a good point. The question is, I guess, how do we engage those folks? Yeah. I mean, the idea of a vaccine passport, for example, most other provinces are now doing it, maybe except Alberta, although we're not quite sure where they're going. But Quebec already has theirs in place. Ontario announced theirs. Manitoba's is in place. So if that's what people are upset about, how does BC not do that when everyone else is doing it? Katy, just carry on maybe with that. Second question to you.
Yeah, and I am not suggesting at all that we shouldn't be pursuing this initiative. I think it's important, but I think it's important that the message really focus on the fact that this is an extraordinary measure and it's time limited. And we are doing this because it is our best defense against a raging Delta variant. And in order, like we need to do this, but we also need to keep emphasizing that sunset clause. And just, I think any discussion of this being like a permanent shift in society is not going to be helpful to that crowd. And it's not going to be helpful to, average people either. I don't know if that was a helpful answer, but.
Yeah, no, it's interesting. Jillian, what do you jump in here? What do you make of all this?
I think that, we're getting more details about the rollout of the vaccine certificates on Tuesday. So we'll see what that looks like. I think you're right. Like, I think there's sort of, the extreme kind of fringe of people that are protesting on the streets. And that was really hard for a lot of people to watch. But I think that, there's also people that weren't protesting that have concerns, and businesses that have concerns about how it's going to be implemented. And I think the province can spend more time and energy making sure that the details of that are fleshed out and that they're really supporting businesses. I think, thinking about it, kind of a week later after the announcement, I think there's a lot that they can do. Dr. Henry talked about in the initial press conference about how it's really just the same as servers asking for an ID. Well, you have to do a course in order to serve alcohol in BC that teaches you how to do that responsibly. And businesses in my community have had to order security. There could be support for them to have to, if they have to do that, support on the enforcement side, these kinds of things. So I think the province not just sort of dropping this on everybody and being like, you deal with it, and instead providing more support as an acknowledgement that this is extraordinary, that it is going to be a difficult thing for folks to manage, would go a long way to sort of softening the blow a little bit.
Yeah, there's a lot of good points there, and I often wonder, should we have some point in the last 18 months as a province hired or trained or brought in some type of enhanced COVID enforcement bylaw squad or extra staff or something that we could be using to help businesses as they wrestle with mask mandates and enforcement of other things? Because the answer to a lot of the questions and uncertainty for businesses is, well, you figure it out. You figure out how to do this and then call the police if there's a problem. And that angers people. And I do kind of wonder if the province had announced the vaccine passports with an example of how it works, an image and a video of what it's going to look like, the technology, an enhanced team of people who are going to be in different parts of the province, supports or grants or whatever, and package that out, would we have seen the protests or the Facebook groups that we're seeing? I don't know. Maclean, you want to jump in?
I think yes, we would have seen some of the protests. I think they're probably right to suggest they wouldn't be quite so widespread. There's a persistent fifth of the population, which is a large minority, that just refuses to get vaccinated for what I assume is a collection of reasons. But you're right. I mean, the province could do things better in terms of providing details. Katie's point about a sunset clause is really well taken, in that a lot of people's worst fears about government conspiracies seem to be kind of getting realized from their point of view. If they're, well, we're going to be giving you this thing to do anything from now on, and it is from now on. We're not even giving you a pretend go away date. So you're right. I think by giving him more details for the announcements, examples, sunset clauses, that would help a lot. But at the same time, Justin Trudeau's talked about this, John Horgan's talked about this, and so did Bonnie Henry the other day. There's a lot of anger and frustration out there, and we should not underestimate how tough this pandemic has been on a lot of people. There's a lot of mental trauma out there, and it is coming out in some very dangerous, quite frankly, and unhealthy ways. But I mean, we can't just pretend that hasn't happened and that people are in their right frame of mind, because, look out there, they're not.
And the difficulty is, I guess, and the compassion disappears when and people entrench in their different positions. And
Hmm.
the protest had so many different components to it, and yet it can be so very easily labeled as anti-vaxxer, and then
Yeah.
people start picking sides, and it's either good or bad. And but you're right, as Katie pointed out at the beginning, the Facebook group from businesses that are concerned, that's a complicated issue as well. Maclean, we'll stick with you, and then we'll go back to Jillian to do this. But what should government do with this information now? Is there anything it can do to put the toothpaste back in the tube when it comes to the vaccine passports? We get more details Tuesday, but late details don't solve people's anxiety that they've already doubled down on. Is there a path here that it should be following, do you think?
Yes, I mean, ideally they'd go back in time and share some of these details, but they can't do that. So, yeah, Tuesday will be crucial, because some of the questions and concerns laid out by the restaurant industry. There was a great piece in, I think, the Times columnist this morning, talking about some of their many concerns: security, paying for signage, training, and also the province could do better. And Dr. Bonnie Henry as well. It's really awful to tell places that it's just the same as asking for your ID. It's plainly not, because we are awash in videos of people getting very upset about vaccine passports, mandatory masks, and sometimes assaulting people. That just doesn't happen when you're getting asked for your ID at the bar, even if you are underage.
Hmm.
I think we've all been there. So it's kind of a false comparison, and when you start saying things that people know implicitly aren't true, it undermines everything else you're trying to say. So yes, the province needs to provide a lot more details, a lot more reassurances in that on Tuesday for the reasonable types. And for the stridently angry fringe, and they are out there, it's tough. I don't have, there is no magic bullet here. I am firmly convinced that you cannot persuade someone who's on the fence about getting a vaccine that they should get vaccinated by calling them, an uneducated rube or a hick and stupid. That's just not going to work. If you push them in a corner, they're going to stay there. So, as difficult as it is for those of us who are not in that fringe, I don't think screaming at them is going to help. In fact, I'm positive it's completely counterproductive, although it is much more difficult.
Jillian, during one of our previous shows when you weren't here, we voted you as our rural correspondent based on where you live, which I know you relish that title. But in other parts of BC outside of Metro Vancouver and the Lower Mainland, and I was thinking like in the Peace region, for example, you have such a low vaccination rate that some of the businesses there are warning half of the community almost is going to be unable to access non-essential services under this vaccine passport system, putting frontline workers in a position of turning away 50% of the folks who walk in, if assuming. Is it different, do you think, outside of the metro regions, and should that influence what the province is doing with this passport and the details they come up with on Tuesday?
Yeah, I mean, we have a really regionally diverse province. I think, one of the things I was thinking about after our last show, like where there's sort of opposition coming from business owners, is that in smaller communities, they're so connected to their community. So even if they're vaccinated themselves, they support getting, people getting vaccinated. They don't want to be part of something that could be divisive, because they're used to having a really kind of close connection with the people that live in their community. So yeah, I mean, it's hard for the provincial government. I think they can work with local chambers of commerce who are really like, have their ear to the ground on their communities to sort of, and that's something that they've done with the mask mandate. Like our local chamber of commerce has signage they distribute to all the businesses and these sorts of things. But yeah, there's no silver bullet. It's lots of, very minute kind of work, sort of bringing people along and making sure they feel supported and making sure that they're able to implement these policies in a way that works for their communities.
Yeah, tough work on a tough file. So I'm sure that's not the last that we have heard about those protests, despite how I think the targeting the healthcare centers really was the problem with a lot of them, and the reason we're still talking about it now. Moving on to another subject here, the overdose crisis. We received the latest update from the coroner this week that the first 6 months of this year had the highest total of overdoses in any first half of any year in BC's history, more than 1,000. We're now at 7,700 overdose deaths, and drug overdoses and the toxic drug supply is now the leading cause of death for people in BC aged 19 to 39. The leading cause of death, not car crashes or something else you might associate with that group. Drug overdoses. Let's go around and talk about that. There's various different things. The mental health minister appeared caught off guard, was not available initially when this came out, and then suddenly scrambled. The government's reaction has been, they didn't really react. The coroner took a few swipes at the province in her address here. What stands out to you, Maclean, on this, and what we do about it, I guess, at this point?
I mean, at the risk of appearing like I'm sucking up, I don't think I can put it better than you did writing about it this week. The province's approach hasn't worked. It's plain. The numbers are what they are. They're heartbreaking and disgusting and embarrassing. And something's got to change. Enough is enough. And you're quite right to point out that the day the coroner released these numbers, the mental health and addictions minister was nowhere to be found, and in fact was told that we were told that she wasn't available for interviews. Now she changed that later in the day, but to appear to be caught off guard by this is just it's inexcusable. This is literally your sole focus. It's the reason this ministry was created to great fanfare, and the whether it's the minister herself or just the structural the structure of her ministry, which doesn't actually control many of the decisions or funding or anything like that. It's kind of a ministry of state in some ways to the Ministry of Health, or if it's just our complete policy-wide approach to everything from legalization to decriminalization to treatment, or all of the above. Something's got to change, and it needs to change right now because what were the numbers for the 6 months of this year? It's 1,100.
11,000.
Yeah. 1,800 British Columbians have died of COVID-19 since March 2020. I mean, this is not the other public health crisis. COVID-19 is the other public health crisis in terms of death.
Yeah.
And to pretend like it isn't is just that. It's pretending.
There was a lot the coroner said about barriers here, and one of them she said is that we're all slow to change our perspective on what's right and wrong, and that so for many years we've seen drugs as wrong, the people who use them as bad, and addiction as just being a weakness that you should be able to get over, and that doctors are still facing this and prescribing safe supply. Others, there's these barriers that exist in our society, even just talking about this, Katy. Um, yeah, I don't even know what we do here, but what do you think of where we're at, I guess?
Yeah, so I want to comment on the minister's absence. First of all, like International Overdose Awareness Day, that was the same day that coroner's data came out. This is the one day a year where everyone can mourn those who have lost their lives to drug use and overdose. It's about 500,000 people every year. As Maclean noted, the comparison with COVID is incredible. Like 1,824 for COVID for 2 years compared to 1,106 months. And yet look at the response that we've had to both of these crises. For her to decide that this was a great day to take off, like imagine being a person struggling with addiction. Imagine being a parent who has lost your kid to overdose, and she basically just thumbed her nose and said, I don't have time for you. And so I've said for a long time, I think we all have agreed that this minister is utterly incompetent. She is not capable of handling this file. And I will, like, the NDP has a lot of bench strength. They've got some really talented ministers, but she's got to go. Like, this is going to be a problem for them once we finally bid adieu to COVID and hopefully turn our attention to where the level that it should have been for years now, to this crisis. In terms of what we do going forward, where I get a little bit concerned is that when we talk about things that initiatives that we need to pursue, they are yet again always on the harm reduction side. And I'm not saying that we shouldn't pursue these initiatives, but why are we so committed to half measures? Like, why do we not want to view addiction as a chronic illness like we treat other chronic illnesses, which is from when you contract it, like from when you're affected by it, all the way to your recovery, and you're supported the entire way. Like, the fact that recovery is somehow dismissed as some crazed right-wing religious fundamentalism, that's insane. And so it's really time. In fact, I like what Sonia Furstenau in the Greens has done, which is to suggest that it's time to put our spears down and just get a cross-partisan committee, because I think that everyone's viewpoint needs to be taken into consideration here so that we actually do create a full continuum of care.
Yeah.
I could talk about this issue for like hours on end, but.
Well, I agree with Sonia Furstenau, and I think it's actually, I've been very critical of Sheila Malcolmson, but I actually think it's such a serious issue now, we shouldn't be talking about Sheila Malcolmson. She should just simply be, it should just change, and no one should comment on it, criticize it, make it a political issue, talk about a weakness, or criticize the premier for the shuffle or the government change. Just do it and just let it happen, because it has to happen. We need a different approach, and we need a different person in charge. I was hypothesizing someone like David Eby, who, as the Attorney General, could find the legal grounds to simply charge forward on decrim and safe supply and take the consequences from Ottawa and Health Canada and the RCMP and whoever else plans to take us to court for not agreeing to this or whatever. But there are other people, Selena Robinson, other folks who could maybe pick this up as well. Jillian, what do you think of where we're at and where we should go?
Yeah, I think, I agree that, decriminalization and the expansion of safe supply are part of the puzzle. I agree with Katy as well that treatment is also essential. The government did make a big investment in mental health, but the problem in the last budget, but the problem is that it's so underfunded that most of this money is going to crisis beds when, I would say it starts even earlier from the point that somebody takes substances. Addiction is rooted in trauma, which happens even before that. So we need, mental health services throughout, everybody's life that are part of our medical system. And so I think that the hill is so, large to climb on this, that's why the government is reluctant to put it, with a minister that would have to climb it, because I don't think they think that they can do what's necessary. If they wanted to do a de facto decriminalization, they know how to do that. Dr. Henry has laid out how to do that. but they don't want to. They want to pass the buck to Ottawa. And I mean, I think they are sincerely hoping that the Liberal government was going to grant a public health exemption for criminalization. But, now we're looking at the polls and we might not have a Liberal government. So, I mean, it's back to the drawing board, and that's why you don't pass the buck, I guess. But
Wouldn't it be
yeah, I think
fascinating to just have a letter telling Ottawa from the BC government signed by the opposition leader and the Green leader saying, "To hell with your stupid decriminalization policies. We're doing it. See you in court if you want to take us into court, but that's what we're doing." And bon
and we did
voyage,
it.
Health Canada.
Vancouver.
Yeah.
We did it with safe injection sites. It saved a lot of lives. We've effectively eliminated HIV on the downtown east side. Like it's like it's been done before. It can be done. So.
Katy, you got 30 seconds. Take us home on this, and then we'll go to the podcast portion, and we can keep talking if you want.
Sure. I think it's really imperative that we view addiction treatment and arresting overdose or eliminating drug toxicity as two very separate things. Like addiction is a neurobiological progressive condition, fatal if left untreated. Safe supply and decrim, like making drugs easier for people to use and putting the same drug that they got addicted to in the first place does nothing to help them get better. But there is still, on the other side, in terms of drug toxicity, there is arguments for that. I just think it's really important that we look at those two in silo.
Sure, yeah. And I think the reason we're the emphasis being on one right now is because people keep dying in increasing numbers, and the idea is stop the deaths, and then. But you're right, there needs to be a step after that into then what, and what are our supports and services to help someone not go back and then face the same toxic drug supply. Okay, that's good. It was a great conversation. We're going to wrap it up here for the TV portion. Stick around for the audio podcast. We got more content coming your way, including the federal election. Thank you for watching. Make sure you check us out on the Check Plus app to get all your past episodes. And here we will see you next week on Political Capital.